patients with asthma, there are multiple things that are influencing asthma control. This includes allergies, infections, environmental factors, and one of the most important is patient compliance. So when we start to think about our patients that do not have well-controlled asthma, we start breaking them down into trying to figure out why. And so there are those patients that have good control on therapy and those that have poor control, and they fit into the three groups. And so most patients are treatment responsive, but there's something getting in the way of that. So that's if we take these patients and we admit them to the hospital, we monitor them, we take them away from the cat that's causing them problems, we make sure they take their medicines, they're doing fine. And most patients fall into this group. A subset of patients have other comorbidities that can influence asthma, and we're going to talk about some of them. And then a small subset of patients actually have severe refractory asthma. So what are some of the factors that can negatively influence asthma control? And compliance and adherence is the biggest one of them. So we all hope that when we see patients and we guide them and tell them what our recommendation is for their asthma therapy, that they're going to go home and do it. But unfortunately, like many chronic disorders, it just doesn't work that way. So for patients that have an infection and we give them a week of antibiotics, it's easy for them to be compliant with that regimen. But when they are leaving our office with a diagnosis of a chronic disorder and we're asking them to do multiple medicines every day, they don't always do what we ask. And so these are just some of the highlighted papers I wanted to bring up that really document the low rate of compliance that our asthmatic patients have. So one study looked at patients that were diagnosed with asthma and they were placed on an inhaled steroid, and they followed these patients for up to a year. And at the 1 year point, if those patients still were supposed to be on their inhaled steroid, less than 10% of those patients actually were still doing it. Numerous studies across chronic diseases, so this is looking at diabetes and hypertension, have showed similar findings. And it's particularly important in those patients that we see with severe refractory asthma, because if they are having severe asthma despite taking medicines, this lack of perceived benefit from prior therapies can further erode their commitment to taking the daily medicines. So what are some other barriers to adherence? And cost always is at the top of the list. Like all of us, our patients are struggling with the increasing cost of daily living, of medications, and it's going to be really important to address this. Patients don't like to talk about it. They want to please us, and so they're always going to nod their head, and we have to make sure that we're sensitive to the fact that many of our patients could be struggling to get our medications. The second and third really relies on us to train them appropriately. So when we see patients, even patients that are newly diagnosed asthmatics, sometimes that can be really overwhelming for the families and for parents. And we spend time talking about asthma, we go over the medications, we may even show them how to do it, but they're so overwhelmed that when they walk out, they just don't remember any of it. So this is just a reminder that every time the patient comes in, even if they have long-standing asthma, it's really important to go through or have either an asthma educator, a nurse, or ourselves go through it to make sure that they're using it correctly. Inappropriate expectations can be really problematic in children. So oftentimes we see parents that are steroid phobic, and the kid is having lots of coughing and wheezing that we think may be asthma. We talk about asthma, we get them on an inhaled steroid, but if the family thinks that just because they're on that steroid, they're never going to have symptoms again, or the next time they have a cold, they're not going to have problems, when they start to have problems, it's really going to erode their confidence in what we talked about, and it may cause them to stop using their daily medication. And then particularly in teenagers, ambivalence and failure to buy into the diagnosis can be particularly problematic. So kids, teenagers, young adults in particular, they don't want to have a diagnosis. They don't want to be different. And if we don't realize that, sometimes they may not perceive their symptoms and they may not buy into our treatment plan. And then it's always important to keep in mind that both religious and cultural perceptions really influence asthma control. So as a provider, we have a certain belief of what asthma is and how we treat it. But it's important to understand that our patients are coming from a different perspective, and the lens by which they're viewing asthma could be very different than ours. And this can really influence what it means to have asthma, what it means in the context of their community. And so we have to take those things into account when we're trying to manage them.